So this breakout room will focus on children and youth who have special or complex needs and the impact of disasters on that specific population. To speak with us today, we have Anne-Marie, and I'm sorry, I don't want to butcher your last name.
That's quite all right. It's
I will let you
Sabrasula.
pronounce it.
Yep.
Sabrasula.
Anne-Marie Sabrasula, yep.
Who will be our moderator. And then we have three great panelists who will talk about this as well. So with this, I will hand it over to Anne-Marie to start the
Terrific. Thank you. As Aurelia said, I'm Anne-Marie Sabrasula. I'm a co-administrator at the ARC Westchester's Children's School for Early Development, which is a special education preschool located in Westchester County, just north of New York City. I'm very excited and honored to host this discussion regarding the experiences of children and youth with complex needs and the providers and organizations that serve them during and after disasters. Before we begin, I'd like to welcome our panel members. We have Carmen Sanchez, here, excuse me. I'm Carmen Sanchez, Education Program Specialist at the United States Department of Education. Dr. Kate Moran, also Education Program Specialist at the U.S. Department of Education. And Dr. Laura Stow, Associate Professor and Assistant Director of the Center on Disability and Development at Texas A&M University. Just as a reminder, the bios for everyone who is presenting this afternoon is in the booklet that you should have received, the briefing book. And I think we're ready to begin. I think first we have speaking Carmen and Kate.
Correct. As she's pulling up the presentation, I'll just share a little bit of my role at the U.S. Department of Education. I'm actually a disaster response team member and went to Puerto Rico during some of the concurrent disasters, and so was on the ground working with FEMA as a disability integration specialist. That was kind of while I was working with the U.S. Department of Education, because we had so many concurrent disasters, they had put out a request for a surge capacity force. So that kind of led to my integration of working with the disaster response work and our students with disabilities. And our disaster response team within the monitoring, state improvement planning, and the research to practice division, together we are OSEP. Our work focuses on natural disasters, medical disasters, and in addition, any man-made that we would say like teacher strikes, things like that, anything that's gonna kind of impact the education and disrupt learning. So of course, we are very busy right now, but today we're really excited to be here to talk to you about some of these experiences that folks with disabilities, the infants and toddlers, and our students during disaster. So if you want to go to the next slide, Aurelia. Or Carmen, do you want to say anything just kind of about your work before we get into the slides?
So I'm Carmen Sanchez, and I work on the other side, which is the research to practice. We administer discretionary grants, and before I start about my section, I'll talk a little bit about the grants in particular that I manage and how they're related to disaster relief. So
great. And I will share, and we'll talk about this a little bit later on, but there is a disaster response unit within the U.S. Department of Education. Our office collaborates with them. They are the office that actually oversees and is working with states on the funds that were flowed to some of these states. But our disaster response team works on some different areas. So I just want to make sure that if you see a disaster response unit and our disaster response team, they're kind of two different entities within the Department of Education. So I wanted to start off with some scenes that we saw in Hurricane Maria in Puerto Rico. These are up on the western side of the island. We had complete destruction of homes. You can see the bottom left is a picture. This was the road that we had to take to get up to a home that was way up in the mountains of an individual who had an electric wheelchair, who wasn't able to even use that wheelchair because it was so high up in the mountains, they weren't able to bring it down when the family was moved to one of the shelters. The one on the bottom right is a small village that again was up in the mountainous areas in Maya West. I think it was in Daria Alta, and they had no power up in those areas. If you want to go to the next slide, I'm going to talk briefly about some of the barriers that we faced, and then some of the supports that that we would recommend folks put into place. So the picture on the left is of a elevator of an individual who lived on the second floor of a home there, and she had been unable to kind of leave her home for a couple of months because the power and the electricity had been out. So these are things we want to think about, that when the power and the electricity goes out, it's not just that you can't get your food, or you may not be able to leave your home if you're somebody with a disability and you have a wheelchair. And the only way that you can get in and out is using that elevator. We also worked a lot with families getting access to power so that they could use their oxygen tanks. We also ended up having to get different types of fuel. So those were things that you have to think about, that, you know, we had somebody who only could have a propane. They needed a propane tank because the regular fuel would have upset like the oxygen tank. And so we had to work with the municipality to try to get them fuel. And the one on the far left is, again, that was the wheelchair, the electric wheelchair that was stuck up in the mountains. But let me talk through a couple more barriers. Many states lost power, and therefore technology was a major barrier. The loss of power led to an inability to charge phones or access the internet. It made it difficult to contact or reach out to families or carry out business at state offices. Many families moved from their disaster locations, and therefore some of our child count and assessment data was impacted and was a challenge to kind of track. Our office really looks at the students enrolled in schools and who are eligible for special education services. Another barrier, some of these remote areas, as I've shown here, made it difficult to even identify need and account for some of the infants and toddlers and children with disabilities. So some of the providers in our Part C programs who go into the homes and work with the families, they weren't even able to get to some of those families after these disasters. And survivors were in great need of durable medical equipment, wheelchairs, positional beds, and often due to displacement had to leave many of the items they needed behind, such as the oxygen tank, breathing tubes, and feeding equipment. And when I was working with FEMA and collaborating with them and some other, Red Cross and agencies, we were getting wheelchairs. We were trying to, connect folks back to their own equipment, like this gentleman who needed his electric wheelchair. If you want to go to the next slide, Aurelia, I'll talk a little bit about the supports. So again, these are just some pictures of activities that we're doing. The one on the left was, of course, food, general staple items. We assisted some families in getting that. The one on the far right is of us delivering a push wheelchair. It wasn't an electric one, but for an individual who needed that. And then the one in the center, which was really exciting, was a deaf and hearing community meeting so that folks who were impacted by these disasters could come. There were translators on site to help them fill out forms and things like that so that they could access some of these supports. So those are things to think about as well, that there are multiple disability communities that you need to be thinking about when these disasters hit. So just thinking back through our barriers, when we've lost power, we want to assist the states in coordinating the access to supplies such as the generators, solar generators, and in some instances, completely new office spaces. I know some of our Part C programs and even some schools, they needed to get a new space to even work out of. So helping to coordinate that, trying to funnel resources from various agencies. So Red Cross, get FEMA involved, get these various entities involved so that, sometimes like the gentleman, they needed the propane tank. they had been waiting months for that. And it just took FEMA kind of coming in, coordinating with the municipality. And within a week, they actually got the power turned on for that small grid of the town, which was exciting. We want to ensure that we're working with states to ensure that systems are in place to account for loss of paper documents. So really these areas that are impacted by disasters, Puerto Rico, you know, in the South and Texas, the fires in California, can we get this information onto virtual, you know, spaces rather than keeping paper copies of so many of these items that backup data systems, Virgin Islands were impacted. And keeping some of that information perhaps offsite if you're not able to get it digital, things to just think about. Ensuring direct contact with municipalities and cities, consulting with OSEP funded TA centers, which Carmen's gonna speak about more. And a lot of cities and municipalities were collecting detailed information of the individuals that live within their jurisdiction. So making sure that when the disaster hits, that all the agencies are kind of aware of where the needs are. And so touching base with FEMA, touching base with Red Cross, and seeing that information. And Carmen's going to talk a little more later about what some actual localities are doing and actually collecting specific information. And then also just keeping in mind that our office, OSEP, can assist with some of this agency collaboration. Carmen and I worked very closely when I was on site in Puerto Rico of connecting various centers that, you know, the FEMA disability integration specialist that I was working with didn't even know about the Part C programs or that they're like what that was. And that coordinator, that person overseeing those programs has knowledge of the families within a particular area that might be impacted by that disaster. So coordinating with Part C coordinators, coordinating with the special education directors within states is really going to be key to identifying where's the support needed. And next slide, we'll move to Carmen. Hopefully I didn't talk too far over. I know we had a little extra time, so.
Thanks, Kate. So thank you again for this opportunity to speak about the needs of children with disabilities and also with special healthcare needs and their families, because the kids are part of the family, so it's really a family need. I do want to talk a little bit about a specific story that's related to Hurricane Maria, and that actually Kate was very helpful with also. But first, I just want to give you a little bit of background on the discretionary grants that we provide in the Department of Education that are authorized through the Individuals with Disabilities Education Act, which most of you know as IDEA. And those are and some of those grants that I help to manage. We have specifically grants to nonprofit parent organizations, and they're meant specifically to help families of kids with disabilities learn about their rights under IDEA, and also they're meant to help them work with educators and professionals to meet their children's needs, educational needs. And I say educational needs, however, over time, that has sort of, you can't separate out the children's educational needs from their health needs or from some other fundamental needs that they have. These grants now go back close to over 40 years now, and even though they're grants of 5-year cycles, many of the organizations have held the same grants in their states cycle after cycle. So over a course of 30, 40 years, they've expanded to become essentially one-stop shops for families of kids with disabilities and special health care needs. Many receive other federal funding from federal programs such as the Family to Family Health Information Centers funded through Health and Human Services. So the organization may be known by their organizational name in the state, but they actually encompass multiple grants, and therefore, like I said, they become a one-stop shop for families trying to find information. The program of the centers we fund through the Department of Education is extremely tightly knit. We collect programmatic information across 96 current centers, and together they formed a real community, in part, like I said, because year after year, I mean, cycle after cycle, it's the same nonprofits who get the funding. We also found one national center, the Center for Parent Information and Resources, which we call either SIPR. We sometimes refer to it as the hub. You see on your screen a page from it, I'll talk directly about that page in a minute. And we also fund 4 regional technical assistance centers to those parent centers. So because we have these technical assistance centers, both national and the regional, like I said, they're really crucial in making sure that the parent centers share information during disasters. We became really aware of the necessity to share information and to do warm handoffs when families were moving between states as a result of disasters, and that became very clear during Katrina, since so many people went from Louisiana to Texas and were in shelters there. And since Katrina, the parent centers have deepened their connection to each other, and they've shared resources also. Can we go back one more page? I think you went ahead a little bit. So the slide just before this is a resource that was developed. It's a web page that brings together a host of curated disaster-related resources so that the parent center, when helping parents in their state or area that's come up in a disaster, they can go to this one place. It's resources from everywhere, from FEMA, from a lot of other places, but it's curated so that the staff members don't have to do the research, don't have to do the work, and can therefore be able to direct families more quickly. This also extends now to the current pandemic that we're under, and SIPR has put together resources in a very strategic way, so to make it easier for the parent centers and parents themselves to find applicable resources, and more importantly, not overwhelm the staff, because especially during this pandemic, you'll notice that the staff are themselves families and people who are also experiencing the pandemic. So going back to that story I was telling you about, Hurricane Maria, when it hit Puerto Rico, a family that was a mother, a grandmother, and an older teenager with significant disabilities who used an electric wheelchair, who had to be fed pureed food. They were stranded in their apartment in one of the top floors of a high-rise in San Juan. Each day the mother would walk down the stairs to look for food and walk back up those number of flights in order to bring the food and grind it for her son so that he could eat. They were getting desperate. The Parent Training Information Center that we fund in Puerto Rico was closed, not only because of the physical condition of the office, which was pretty traumatic, but also because of the living conditions of the employees who themselves were, of course, experiencing this disaster. However, many of the employees and the director were checking in as best they could with the families that they knew needed help and trying to connect them with resources. So this mom, somehow or another, she got a phone number for the parent center in New Jersey, of all places, probably through a family member. And New Jersey in turn contacted me because I had the cell phone number for the parent center staff in Puerto Rico. And when they were able to finally get to cell coverage, they saw my message. And then we were able to eventually, and we worked with Kate, we worked with FEMA, we were able to get that family moved to a place that was safe and that could also meet their needs. In the wake of Maria, many of the families left Puerto Rico for Florida and a lot of the states in the Northeast. And again, that's when it was important for the center in Puerto Rico to contact the centers where they were going so that there would be as warm of a handoff as possible so the families would know what resources was available in the new state that they moved to. And again, this built on the work that occurred during Hurricane Katrina. So families of children with disabilities during disasters, they need the government, but they also need to see that the government and other nonprofits and other people see, and that there be concern for them, that they be aware of where they are. Fairfax County, Virginia, when I was working there 15, 16 years ago, they had started a special needs emergency registry at the time, which was separate, which was a way of trying to figure out where people with special needs were so that case of disasters, they could be contacted, they could be checked up on. Now it's actually part of their general emergency alert system. So if you go in and say, I want to get an alert, you can self-identify as having a family member or yourself as having some sort of special need related to a medical condition, disability. And also put in that you need sign language interpretation and other kinds of accommodations because of a disability. And during emergencies, the efforts of many, not just one, can really be vital lifelines to families. After the California wildfires, the Parent Center that we have in Northern California contacted a nonprofit project called the School Box Project. The School Box Project serves primarily people, refugees in war zones and other places throughout the world. But they got in contact with them because what they do is they bring in shipping containers that have been transformed essentially into schools or safe places for children to play and to have a safe space during trauma. So even though the service was for all families and was clear it was for all families, the families of children with disabilities that found out about this service in California were really grateful that they had this because it helped relieve some of the services. And it's, I said it's the School Boxproject.org is their place. So the parent centers are really well connected with their communities, and they're often the trusted source of information in their community. During the Flint water crisis, we provided some supplementary funding to the Parent Center in Michigan to provide information to families about lead. And they used staff that knew the community well, that the community trusted, so that they were a trusted source of information. We also, in the department, provided supplementary funding to the parent centers in both Puerto Rico and the Virgin Islands after the hurricanes to provide trauma-informed ongoing care and supports to families as they navigated the new normal and navigated the educational needs of their children in this new environment. Next slide. So I'm going to stop now, but I want to point out some of the resources that are available both on the Department of Education's website and the grantees' websites. The first one is, as I mentioned, the parentcenterhub.org, which is a Center for Parent Information and Resources. And there, like I said, there's a special page just for COVID-19. There's also Readiness and Emergency Management Technical Assistance Centers for schools overall, and also for programs, early childhood programs. That's available, and that's and then there's also a page that's specific to hurricane help from, these are both pages from our department. The last two bullets are from our two largest technical assistance centers for special education students and their families, and also early learners with disabilities and their families, National Center for Systemic Improvement and the Early Childhood Technical Assistance, because they've created a hub for a lot of COVID-19 resources that gathers information from all levels, from federal, state, and local agencies. So those are some of the resources we have. And with that, the last slide is just our contact information. And of course, we're available to engage in discussion. And thank you again for this opportunity.
Thank you both. I think we're waiting till after all the panelists present to go to our questions from the audience. So
That's right.
I think Laura, you would be up next, Dr. Sal.
So I'll just go ahead and start while the slides are loading. As Anne-Marie said, I'm professor of educational psychology, but also assistant director at the Center on Disability and Development at Texas A&M University. And that center is one of 67 federally funded university affiliated research centers on excellence in developmental disabilities in the US and US territories. The focus of my presentation in this session will be on the psychological and social effects of disaster on children and youth with disabilities. So slide 2, please, when you get it up.
Yep, it just crashed, but it will be up in a second.
Okay.
Apologies for that.
That's all right. That's quite all right.
Okay. Slide 2.
Slide 2. So research on individuals with disabilities and special health care needs has been increasing since the aftermath of Hurricane Katrina in 2005. Most of this research, however, has focused on adults with disabilities rather than children and youth, and is limited. But the evidence base that we do have confirms that people with disabilities in general are disproportionately affected by disasters. For example, research shows that people with disabilities have a higher mortality rate, particularly when the disaster includes the need to evacuate quickly to shelter in advance of a hazard. And if you think about this research finding for a moment, it makes intuitive sense. If you have a mobility or a sensory impairment and you have to run or climb or quickly evacuate on your own, that makes rapid onset disasters particularly dangerous. People with disabilities also incur higher property loss, which seems to be associated with a higher likelihood of living in floodplains or in housing structures that are more vulnerable to disaster. In addition, people with disabilities and other functional access needs may need additional supports to evacuate and shelter, and need supports within those shelters and in finding temporary shelters and connecting to other services. Following disasters, what we see is that people with disabilities often require more intensive case management, and they have more complex support recovery needs. As a result, people with disabilities and their household members can take longer to recover from disaster. So together, these general findings about people with disabilities suggest that they are more likely to experience disaster, and when they do experience disaster, they're hit harder. Next slide, slide 3. So Dr. David Markinson touched earlier on the particular needs of children with special health care needs. It's estimated that nearly 20% of US children under 18 have special health care needs. And those include things like asthma, cerebral palsy, anxiety, allergies, epilepsy, and many children with disabilities have difficulties with functions such as mobility, communication, or learning. Slide 4, please. So children with disabilities and their families often rely on educational and community supports that can be disrupted in disasters. And children with disabilities are at risk for disparities in educational services and behavioral complications post-disaster. However, studies at the same time report varying preparation in families of children with disabilities, preparation for disasters. And so these findings are concerning since many of these children, as have been commented earlier, require special equipment, supplies, or medical care. So when access to these resources are disrupted, in hazards or emergencies, that can particularly affect these children and these families. So there are some steps, some studies that have been undertaken to help these families to become better prepared for environmental hazards. For instance, one intervention that proved highly successful involved healthcare providers distributing a disaster starter kit to families. There's also been some public health interventions that have involved educating parents or incorporating preparedness into patient treatment plans. These types of interventions, however, are not widespread or regularly included into medical systems of care. Next slide, slide 5. So when rapid evacuation is required, preparedness for children with disabilities is really critical, as I mentioned earlier. And a recent series of studies I've completed with Dr. McAdams-Ducey investigated the experience of children and youth with disabilities exposed to the 2017 Northern California wildfires. Next slide. Many of these children required specialized medical care as well as durable medical equipment, that had to be evacuated along with them. And, you know, both Carmen Sanchez and Kate Moran discussed this issue as part of their remarks earlier. Those kind of items included wheelchairs, communication boards, special foods, supplements, oxygen machines, but packing and accounting for these supports can be really daunting, particularly during rapid evacuations, or even when families have a larger time frame to evacuate, such as in advance of hurricanes. Then we found that once evacuated, families of children with disabilities in our studies faced another set of obstacles. Often after reaching a public shelter, hotel, or other temporary housing, accommodations and structural supports for these children were not adequate. And their needs were often overlooked by voluntary organizations that lost track of these families as the families transitioned from one temporary setting to another. So as a result, families experience considerable stress in addressing their children's critical health and functional needs on their own, while simultaneously trying to navigate the challenges of temporary living situations. So more collaboration is really needed among voluntary agencies, disability organizations, and healthcare providers to help these families get essential supplies, equipment, and support during and post emergencies. Next slide, slide 7. With respect to psychological experiences of children with disabilities and complex needs, our research has found exceedingly few studies in this area. Several small studies on adults indicate that people with developmental disabilities may have difficulties with unusual or unexpected stimuli, such as often occur in emergency situations, you know, emergency alerts, bells, sirens, things like that. But interventions that are adapted for children with cognitive disabilities or autisms are really lacking. And this is really unfortunate, as children with developmental disabilities typically experience disproportionate trauma exposure even before disaster. And so what we found in our own study when we looked at what was offered to children and families post-disaster with respect to psychological treatment is that these psychological supports were not adapted for children with disabilities. And so what we really need are trauma-informed school-based approaches that include children with disabilities. And we need these measures to be practiced by all school personnel, including, for example, school counselors and mental health workers, psychologists. Next slide, slide 8. With respect to school safety, schools have unique features that really make children, all children, vulnerable during disaster. And schooling really takes place in a unique setting with respect to location, organization of activities, construction of buildings, and the need for student supervision. And so, especially of note in school settings, the adult to child ratio is much higher than in other settings. So a single teacher may be overseeing responsibility for dozens of children. So in these settings, the decisions made by teachers are of paramount importance and can directly affect children's lives and well-being. Unfortunately, the needs of children with disabilities are often excluded or under-addressed in school disaster planning. And unfortunately, the same is true of disaster education efforts. Children with disabilities are often overlooked. However, several really nice studies out of New Zealand have demonstrated that children with disabilities even those with cognitive disabilities can effectively participate in disaster risk reduction activities. Next slide, please. That's slide 9. Our previous research has found that special education teachers, along with some personnel, serve as critical supports to children with disabilities and families post-disasters, despite being affected themselves when disasters occur. Teachers often provide essential support to these families, and their roles as educators expand in disasters to include provision of instrumental and of psychological supports, such as where to register to FEMA, where to get food supplies, how to connect with a caseworker. So we found that special educators can be really powerful connectors between these families and community resources. And this kind of support also continues even when schools are closed. So these teachers still call and reach out to the children that they serve and their families. However, other research has revealed really limited training of teachers in disaster preparedness and response. And as was noted earlier, children spend a lot of time in school, not only in school, getting to school, preschool activities, post-school activities, transportation to school. Finally, when children are impacted by disaster, teachers live in the same communities, and they're also affected alongside of the children that they serve. And this becomes really important post-disaster when schools are trying to reopen and they rely on those same teachers to be able to resume instruction. Next slide, slide 10. I was also asked to comment on the roles of voluntary and nonprofit organizations and children with disabilities and special healthcare needs. Very little research exists in this area. Several studies suggest that adults with disabilities are actually often overlooked by volunteers providing disaster response. Many volunteers are not trained to identify people who may require additional support needs or just may not be educated how to interact with people with disabilities. And in addition, people with disabilities in our society are still stigmatized and for that reason may be overlooked or even discriminated against by others. Few voluntary agencies active in disaster, the VOADs, that are part of the National Response Framework, focus specifically on the needs of people with disability. However, in the last several months, through my participation in the Association of University Centers on Disabilities, I've seen increasing participation of disability-related organizations in issues surrounding emergency management. This uptick in interest by disability organizations may be in part because COVID-19 proves to be a particular threat to individuals with developmental disabilities, given underlying medical conditions in this population, even more so among those living in congregate settings. A recent study estimated that the fatality rate to COVID-19 for people with intellectual and developmental disabilities is 2 to 5 times higher than the overall fatality rate in the general population. We have seen disability-related organizations that don't usually provide disaster-related assistance step up to fill new roles during response, but then they can't maintain that level of effort as time goes on. Even though these organizations, particularly I'm talking about post Hurricane Harvey, were offering really needed supports and services, after about 5 months, we started seeing the number of organizations that could sustain that level of effort decline and funding streams dry up. So that level of effort could not be sustained by disability-related organizations post-Hurricane Harvey. So many children with disabilities and complex needs will require accommodations and accessibility measures as part of preparedness, response, and recovery. Unfortunately, in our own work here at Texas A&M, we see that disability-related organizations and the children that they serve are not connected with local emergency management or considered in emergency management planning. We also see a gap in addressing the health, educational, and psychological treatment needs of children with disabilities post-disaster. So in some, much work, much support is needed so that these children and their families can receive equitable and appropriate support both during and post-disaster. And then last slide, and this concludes my presentation, and I look forward to our forthcoming discussions. Thank you.
Thank you all very much. Kendall, do we have questions yet from the audience?
There's none of the Q&A yet.
Okay. I have just a question myself, kind of being sort of at the front lines of providing supports to young children with disabilities and looking sort of what's coming ahead for us regarding sort of, Laura, what you spoke about, those long-term effects and any sort of trauma-based support. I know that there's a gap, but are you aware of any initiative or anything that's kind of promising at the moment regarding a resource for our students with special needs? Oops, sorry, I lost you.
No, I really don't.
Mm-hmm.
There is really a lack of modified psychological treatment for with disabilities, particularly children with intellectual disabilities. And as I mentioned, these children often have higher risk for pre-existing trauma before disaster. I think, of course, children don't exist outside of their families. And in general, what research shows with respect to trauma post-disaster and children is if their families, if their parents are doing well psychologically, they tend to do better psychologically.
Yeah, it's certainly a need that's screaming at us at the moment, which then brings me a little bit back to Carmen and Kate and sort of that cross-agency collaboration. And so much of that, I think if you kind of bring it down to kind of the basics, is training and a level of understanding of the significant challenges that young children and young adults with disabilities present during times of disaster and trauma, what we're experiencing at the moment. So is there anything promising kind of coming out of your efforts regarding that piece, the training end, even before we get to a moment of disaster?
I think some of funded centers that we have they're on a variety of topics, and I think all of them, especially with the current pandemic, they're looking at various support strategies. I know that ECTE and NCSI are holding national calls, national trainings. They're trying to get feedback from states and stakeholders. And a lot of these trainings expand out to parents and teachers and beyond. And so pulling together that information to then provide trainings that will meet the need that they're facing, whether it's this pandemic, whether it's a natural disaster, it doesn't matter. They are working on that. The trauma-informed care, I don't know, Carmen, maybe there's a center that you want to speak to that's specifically doing research around that, because I feel like we were on a call recently, but maybe I'm misthinking that.
So our Center for Parent Information and Resources also put together a page. It's just a page of resources, but it sort of gathers in all the information we have about centers and places who are doing trauma-informed care and how to make a trauma-informed program or how to make a trauma-informed school. It doesn't necessarily get to the nitty-gritty of the kinds of things that Laura's talking about in terms of how to change the curriculum, but it becomes a starting point for looking at trauma-informed care. I think also we have a couple of centers that are focused on behavior, We have the Positive Behavioral Interventions and Support Center, and that also has started to do more around trauma and how to help kids through that, because they will communicate through behavior. And then we also have another one, the National Center for Pyramid Interventions, which is about much younger children and also around behavior. But to Laura's point, something that's very, very specific to helping teachers learn how to help their students through disasters. I think that's been lacking in a very specific way, and perhaps the current situation will push us to put that more on the front burner instead of the back burner.
I do hope so. Yeah.
I just put a link in the, there was an ECTE, the ECTE has a page that deals with disaster that I think is on our PowerPoint, but I'm posting it here because it talks specifically about trauma on that page. So on that page are other resources. Let me see it. It's got emergency preparedness, National Child Traumatic Stress Network. What's the other one? Adverse childhood experiences, children in disasters, trauma and stress. So there's links out to various pages that
great.
Trauma. So I would definitely suggest people check out that page.
Got it.
It'll link you to all
Those are,
yeah.
those are excellent resources. I particularly like what the Center on Child Traumatic Stress is doing.
Yes.
The problem is that these resources are not designed for children with pre-existing disability. It's after trauma or an event has taken place. But for children with pre-existing complex healthcare needs, children with disabilities, these interventions are not forthcoming yet from these really incredible resources we have for other children.
Agreed. And I think, you know, it's oftentimes the teacher's job or the school psychologist or any sort of clinical supports to kind of take that information and adapt it and modify it for their specific population of young children and how they present regarding their disabilities. They're doing great work on that end, but certainly nothing kind of sort of more global where the field is concerned. It's definitely a gap.
And Carmen mentioned earlier that children with disabilities often express anxiety or depression behaviorally, or through changes in levels of activity. But many school counselors are not trained to look at these kind of behaviors as a form of expressing anxiety or depression or grief, right? And for children with communication difficulties or children with moderate to severe disabilities, it may look like they're behaviorally acting out, but that's the only instrument they have to express the trauma that they're experiencing.
Absolutely. I'm just looking to the question and answer. There's always the one. Would the slides be available? Would the participants be able to access the slides from your presentations?
And then there's below. So in the actual Q&A, you'll see there's like 5 questions. One of them says, you spoke about children and youth with general disabilities and more specifically about those with developmental disabilities.
Yeah, not seeing them.
Are we aware of any research or data on the effects of disasters on SPED students who meet the criteria of emotional disturbance or exhibiting challenging behaviors?
Gotcha.
Laura, I think that would probably go to you.
Thank
Yeah,
you.
there's about 2 studies. There was a study that was really interesting, looking at increases in bedwetting and in children pre and post disaster, and it included children with some children with emotional disturbance. It did not find a difference between the 2 groups of children with disabilities and without disabilities. With respect to, there's very little in general about children or adults with different types of mental illness and the effects of disaster on that population. So there's just very, very little out there. There's plenty out there about other kinds of trauma, but not trauma related to environmental hazards.
Thanks, Kate. I found the question.
Yeah.
We have another question here. Just wondering, there's a group, Children of the Brethren, that focuses on the needs of children of disasters. Is there a possibility regarding a connection here, what we've spoken about? Is anyone aware of that group at all?
I'm not.
Laura?
Yeah, I am aware of the group. They do very fine work. To date, I haven't seen that they or other voluntary organizations have really focused on children with disabilities.
We have another, any research on siblings and the impact on students with disabilities? Can they be stress buffering?
Nope.
Nope. Okay.
There's little research, disaster aside, on
Right.
siblings with disabilities. There used to be more of a kind of, not a research project, but the Sibling Support Project did some initial research, but I haven't seen anything recently more related to that. And I think siblings have their own issues, you know, in addition to, and their own issues about anxiety about the future, that, you know, you have to be careful what kind of pressures are put on them also in terms of their development, growing up in a household where they may have a sibling with a significant need.
Absolutely. The pressures others put on them and the ones that they impose
They put on themselves.
Yeah.
Yeah, especially if they're the oldest daughter. Yeah.
Yeah.
That's particularly acute.
Yeah. Being from Texas, is anyone aware of the Developmental Disability Nurses Association, I guess, in the role that they might play in disaster relief for our guys?
Oh, wow. I would just love to connect with them. So let's talk about that. That's an organization I'm not aware of.
Okay.
And whoever that is, look at the Directory of Community Resources, the Texas Directory of Community Resources. And you can sign up there and connect with other organizations that focus on disability and disaster.
Excellent. Excellent. A question regarding children and the cases of children in shelters. How can you work with them specifically, I guess, given the challenges, you know, working within that sort of an environment?
I can speak a little bit to what we did in, I think FEMA is a great connection to get in and working with some of the shelters. We were going into the shelters, interacting with families that, you know, requested it. I think that's the other thing too. You need to be respectful that they have been just, you know, their whole lives have been kind of thrown up in the air and now they're in the shelter. And so to really honor their control over the situation, right? Because there's a lot of people coming at them and just being mindful of that. But I think the shelters were interacting with the schools as far as, like, in Puerto Rico, everything was shut down, so nothing was open at the time. But I think when schools did open, they would have collaborated with them. But as far as just working with the shelters, we were collaborating with the cities. We were then connected to the shelters to be able to have access to their, through FEMA. Now, I don't know, as a regular citizen, you would be able to access that, but I think reaching out to disability integration specialists that are working with FEMA in a particular area are like a really good connection for you to make. I think Carmen and I, like, prior to me working in that, I didn't even know that was kind of like a thing within FEMA. So I'm sure Red Cross probably, maybe they have something similar to that. I'm just not as familiar, but definitely reaching out to those organizations to try to link in. I also think if it's a student, you know, interacting with the school so that they can be working with the shelter as a case manager, as a provider, things like that. Carmen or Laura, I don't know if you have more.
I think you covered it.
Okay.
And then we have another question here. Maybe it's another Carmen and Kate question. Recommendations during disaster for children who are medically fragile or presenting with cancer, dialysis, anything specific to that population of children?
I think, and Laura mentioned this in the research, that there's very little that goes into preparing families for it. There's oftentimes, in part because as a family, you may not want to contemplate the possibility that in addition to a stressful situation you live in under, you'll have another even more stressful situation of a disaster. But I'm just wondering to what extent organizations can help families long before the emergency happen think about how to prepare. That's sometimes what our parent centers also are starting to do. Like, for example, you know, having them have their binder with all their educational information. And that especially after Katrina, they realized people left and they didn't take their IEPs with them. Why would they? It wouldn't be the thing to think about. But, you know, to the extent that they can help families prepare this in order to move quickly is often helpful. Whether it's, you know, they've started to do like write down a list of everything you have to take with you, so you don't have to think about it. It's just there and you can grab things quickly. So I think more work needs to be done around that kind of preparation ahead of time. You know, to the extent to which organizations can do that and can also do it for the families, you know, fill in the blanks in terms of what you have to do. You know, we sometimes provide families with fill in the blanks about your child in order to form the IEP, so the families think about their children in ways they may not be thinking necessarily. The same thing can happen around disaster. And again, I don't think we do that necessarily enough.
Absolutely.
And I would even say, you know, really, I think Dr. Stowe talked about this a little bit in her presentation, but having that preparedness plan in place, specifically if there are medical, like if you need a ventilator, if you need an oxygen tank, if your refrigerator is filled with your medication, and if the power goes out, you're going to lose that all. That can be life-threatening to a diabetic, which I think we saw a lot. So it's having these backup mechanisms. So if power is lost, if, you know, everything shuts down, what will you need to be able to survive? So if it's somebody who has is in a fragile medical state, what are those things that are going to be needed? What do you need to have at home? Is it a solar generator because you're not going to be able to get to fuel? You know, things like that, to be able to think about that and potentially have ready on hand in the event of a disaster.
Hi everyone, Aurelia speaking from the Academies. Just a quick reminder that the breakout room will end in the next minutes, and then we will recap as a full room in the main room. So I've posted the link to the main room in the chat. It's the exact same link that you all used to join this morning. So with this, let me thank our great moderator and our 3 panelists, and we'll see you all in the main room to review what was talked about here and in the other breakout rooms.